Good morning. I am Dr. Tejashwini from Department of Pathology, Narayana Medical College, Nellore. Today, I am here to talk about World Hemophilia Day, which is celebrated on April 17th every year in honor of Frank Schanbel, who is founder of World Federation of Hemophilia. Every year on this day, global bleeding disorders community will come together with a common theme to improve accessibility of healthcare for the individuals with bleeding disorders. For the year 2024, the theme is Equitable Access for All, recognizing all bleeding disorders with a motto of providing accessible healthcare facilities for all the individuals with bleeding disorders, irrespective of age, gender and location where they live. Accessibility for healthcare providers who are qualified is essential for the individuals with hemophilia for timely treatment and management of complications. Unfortunately, the access to healthcare is challenging in developing countries like India. The reason for this lack of access to healthcare is people living in the remote areas, lack of affordability for the cost of treatment, and social stigma for the disease they are suffering from. Whatever may be the reason, lack of access to healthcare will have devastating effects both on physical and emotional well-being of the individual suffering from hemophilia. Hemophilia is a rare and mostly inherited genetic disorder in which blood does not clot normally due to deficiency of clotting factors. This deficiency of clotting factor leads to bleeding for longer duration, either spontaneously or even after minor trauma. According to World Federation of Hemophilia Annual Global Report 2024, approximately 4.54 lakh individuals are suffering from hemophilia worldwide. But actual number is much higher as most of the cases are underreported in Southeast Asian countries. Mean age of diagnosis of hemophilia in Western countries is 8 months, whereas in Southeast Asian countries it is around 4 to 5 years. This disparity in the age of diagnosis of hemophilia is due to lack of awareness of the disease in general population. Hemophilia is caused due to mutation of genes located on X chromosome. Due to its genetic pattern of inheritance, hemophilia is most common in males. Although it is rare, even females suffer from hemophilia. Females with bleeding symptoms are not tested for hemophilia because of misbelief that women cannot have hemophilia. Because of this, most of the females with hemophilia are underdiagnosed. There are two major forms of hemophilia. Hemophilia A due to deficiency of clotting factor 8 and hemophilia B due to deficiency of clotting factor 9. Acquired forms of hemophilia are seen in individuals with autoimmune diseases. Symptoms of disease depend on activity of coagulation factor. If the activity of coagulation factor is less than 1%, then it is severe form of disease. If the activity of coagulation factor is greater than 5%, then it is mild form of disease. Diagnosis can be made based on routine coagulation factor studies and more specific coagulation factor assays. Diagnosis at an early age can prevent complications like joint deformities. For the people with positive family history, genetic testing is mandatory to identify carriers. Proper genetic counseling helps them to take informed decision about becoming pregnant. All the babies with positive family history has to be tested at birth. Alarming signs of hemophilia in toddlers and infants less than 1 year are frequent nose and gum bleeds, bruising even after regular activities, child being fussy and irritable and refuse to walk or crawl due to bleeding into joints and muscle, and seizures due to bleeding into brain. The available modality of treatment is replacement of coagulation factors. Few lifestyle modifications has to be followed in the individuals with hemophilia. Getting a medical alert bracelet with an accurate and relevant health information for first responders and healthcare providers in case of emergency. Contact sports has to be avoided. Muscle strengthening exercises has to be practiced. Seeking a medical advice while taking blood thinners and pain medications. Practicing good oral hygiene. So this April 17th, let us take an opportunity to raise awareness of importance of access to healthcare by supporting the organizations that are working to improve the access to care and advocating for the policies that make treatment more accessible and affordable. By working together, we can make difference in the lives of individuals suffering from hemophilia. Thank you.